Creating a robust action plan from tracer findings involves a systematic approach to identify gaps, ensuring improvements align with Joint Commission International standards and enhance patient care quality. The tracer process encompasses organizing, educating staff, documenting findings, and developing action plans to implement and sustain corrective actions, fostering continuous improvement in healthcare settings. The tracer process aims to assess care processes, evaluate compliance with standards, and identify discrepancies in care delivery, emphasizing communication between staff and patients for optimal outcomes. Tracers provide an integrated review of critical areas, offering patient-focused insights that facilitate standard compliance and the design of targeted organizational improvements. Simply tracing is insufficient. Teams must plan, intervene, monitor, and debrief, identifying opportunities for improvement and implementing comprehensive action plans to enhance patient care. Organizations should assess whether they have a defined improvement model, enabling structured approaches to identify and address gaps, ensuring continuous quality enhancements in healthcare delivery. Improvement models guide the identification of gaps, analyzing their causes, and implementing solutions, ensuring sustained enhancements in care processes and outcomes for patients. Data gathering during tracers involves understanding policies, training, and communication methods, ensuring that documentation reflects adherence to established standards and procedures. Effective documentation during tracers is crucial for analyzing unmet standards, sharing information, and facilitating follow-ups to validate findings and implement necessary improvements. Identifying patterns and trends in tracer findings helps organizations recognize recurring risks, explore contributing factors, and address these issues through targeted improvement strategies. A prioritization matrix aids teams in sorting and ranking options, identifying critical projects to address, and ensuring that efforts focus on areas with the highest impact on patient care. The SAFER matrix provides hospitals with a visual representation of risk levels, assisting in prioritizing areas for improvement based on accreditation survey findings. The SAFER matrix categorizes risks from highest to lowest, guiding organizations in prioritizing improvement initiatives that enhance patient safety and care quality. Benefits of the SAFER matrix include comprehensive risk prioritization, identifying elements with higher risks, and facilitating widespread quality initiatives organized by potential harm levels. A sample prioritization matrix helps teams assess high-risk areas, frequent problems, and improvement opportunities, allowing for targeted actions to enhance patient safety and care quality. Breakout sessions using a prioritization matrix enable teams to review findings, identify top improvement areas, and prepare concise reports, promoting collaborative problem-solving and accountability. A focus tracer on falls programs integrates standards, policies, and patient records, ensuring comprehensive assessments and interventions to reduce fall risks among patients. Pre-work for focus tracers involves selecting units, reviewing patient records, and ensuring compliance with relevant standards and policies, setting the stage for effective tracer execution. IPSG 6 mandates hospitals to assess inpatients for fall risks, implement appropriate interventions, and document measures, ensuring ongoing reassessment for patient safety. IPSG 6.1 requires outpatient fall risk screening and interventions, ensuring documentation and implementation of measures to reduce risks in outpatient settings. The inpatient overview for fall risk management includes comprehensive assessments, care planning, and ongoing reassessment, ensuring patient safety through proactive interventions. The outpatient overview emphasizes defining patient populations for screening, implementing specific interventions for identified risks, and ensuring documentation aligns with organizational standards. Going to the Gemba involves staff familiarization with policies, focusing on screening, intervention processes, and documentation requirements to ensure compliance and enhance patient safety. Sample observations reveal incomplete policies, inappropriate assessment tools, and tools lacking in addressing fall risk factors, highlighting areas for improvement in patient safety protocols. Process observations identify staff competency gaps, lack of patient reassessment, and standardized interventions, emphasizing the need for education and process improvements in fall risk management. A comprehensive monitoring system involves data analysis, staff communication, and visible action on gaps, supporting policy maintenance and continuous improvement in patient care practices. Effective teams are essential for getting work done, fostering a sense of ownership in improvement plans, and ensuring visible leadership support for successful implementation. Creating improvement teams involves analyzing issues, developing work plans, and ensuring leadership representation, promoting ownership and accountability for improvement initiatives. Improvement teams analyze issues, create work plans, and foster a sense of ownership, with leaders showing support to drive successful implementation of improvement initiatives. Solution identification involves comprehensive analysis and creative problem solving, ensuring that interventions effectively address identified gaps and enhance patient care processes. Focusing on policies alone is insufficient. Improvements require inclusive development of protocols and processes, ensuring alignment with standards and regulations. Developing policies should include staff input, consistency with laws, pilot testing, and training, ensuring standardized documentation and implementation for effective improvements. Training alone is inadequate. Fostering staff competency ensures that improvements are effectively integrated into care practices, enhancing patient safety and outcomes. Solutions are interventions aimed at improving processes or outcomes, utilizing change concepts to develop ideas that lead to meaningful enhancements in patient care. Change concept categories prompt organizations to eliminate waste, improve workflow, manage time, and meet customer needs, driving meaningful improvements in patient care processes. Changing the work environment involves implementing solutions that support improvements, enhancing the overall effectiveness and efficiency of patient care practices. Examples of changing the work environment demonstrate practical applications of solutions, showcasing how strategic changes can positively impact patient care and safety. Strength of solutions varies from stronger actions like engineering controls to weaker actions like training, emphasizing the importance of selecting effective interventions. Mistake proofing, or poka-yoke, involves designing processes to minimize errors, ensuring that patient care practices are reliable and safe. Solution categories guide action planning, eliminating waste, improving workflows, and managing time, ensuring patient care processes are efficient and patient-focused. Making changes involves strategic planning, implementation, and monitoring, ensuring that improvements are effectively integrated into daily patient care practices. Managers play a crucial role in implementation, utilizing real-time monitoring and coaching to ensure accountability and maintain high standards in patient care. Patient safety and care risks should be the primary reasons for compliance with standards, reinforcing the importance of adherence beyond accreditation requirements. The control plan is a process improvement tool that assists organizations in maintaining standards, ensuring that improvements are sustained over time. Ongoing tracers are essential for monitoring compliance, demonstrating improvements, and identifying new challenges, contributing to a robust performance improvement program. Monitoring data over time helps organizations assess progress, identify areas for improvement, and ensure that patient care practices consistently meet or exceed targets. Effective use of tracers involves setting clear goals, training teams, standardizing findings, scheduling activities, and assigning responsibilities to ensure comprehensive assessments and improvements. Summarizing tracer findings involves reviewing data, prioritizing issues, sharing results, and developing improvement plans, ensuring that insights lead to actionable enhancements in patient care.